Thank you so much. Today I'm so honored to be invited here to share some of my experiences with you in mobile nursing. Actually, I just been here in 1 month ago in Mindong. So much fun over there. And also Hongda, right? Your Hongda universities. I really want to spend some time tomorrow and the day after tomorrow. Okay, so I cannot tell you how much I love to be here. Okay. In my past around 15 years, I have done lots of research with the mobile devices, especially for the devices Dr. Capazzo just mentioned that. I keep using that, okay? I didn't only have one PDA, I have tons of PDAs. Actually, if you have time to visit my lab in Taiwan, so next time when you come to Taiwan, send an email to me. Okay, I will escort you to my lab. My lab just like a toy room, Toys R Us in my universities. So I have different kinds of toys. Actually, I encourage my students to spend some time playing with toys. Lots of creative ideas and good for health too. Okay. So when we are talking about mobile devices, because it's quite designed differently, and we need to think about how to use that and what's the context of using that differently. It's no more like PC. For example, let me think about that. How many of you have mobile phones? Raise your hand. Mobile phones? Come on, you young generation. How many of you have at least 2 mobile phones? One of them you didn't tell your mom, right? Okay, you didn't give a number to your mothers. Okay, and let me show you what's the difference. For example, here, how many of you can see what's inside the right devices? Let's assume that's the normal size with the screen size of 4 inches. Okay, the normal smartphones. How many of you can see that? Okay, no. Let's try devices with 6 inches. How many of you can see that? Okay, if you can see that at the last row, I can give a scholarship to visit Taiwan, okay? For 2 years.
For 2 years.
At least to get your master's degree, another one. Okay. How about this one? I show you the difference between 6 inch and 7 inches. It might not be so important, but when you start to use the devices, it makes a difference. Think about that. Right now, if you hold the devices with 7-inch display size, would it be easy to hold with your one hand? If it is not, can it be used easily in hospitals by nurses? Because they are so busy, right? So they have different challenges. And also when you're holding mobile devices, you are walking around, right? How about this one? 23 inches, much better, right? Okay, so what do you see on the screen size? So what do you see? Okay, 5 minutes. Oh, don't take so long, 5 seconds. So how many of you see 10 dolphins? Raise your hand if you see 10 dolphins. Raise your hand. Or if you see any dolphin, but no scholarship. Okay. Come on, there are 10 dolphins. 1 here, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you must see differently, right? Okay, that's why I'm trying to tell you. Even with the same screen, the same design, different people will see differently. That's the key point that Dr. Capazzo just mentioned, that user interface. So when the information was displayed on our mobile devices, it's even more challenges, because the screen size is even smaller, right? Okay, so from my experiences, usability is really a key. And that's the key point mentioned by Dr. Capazzo. No matter what kind of technology we are designed to be used by, or no matter professional providers, for example, physicians, nurses, or common people, elder people, young people, we need to think about how they would like to use that. So in my past 15 years, I spent lots of time in designing the interface. How we can design the interface so the information can be well presented, on the mobile devices, so the user would love to use that, okay? And that's really good challenges in 2007. So do you know what happened in 2007? Don't tell me you have another birthday. Okay, that's come out of an iPhone. So before 2007, I spent 10 years in studying mobile devices. And on 2007, I think, wow, I just waste so much time. Okay, before that. Okay, so from my experiences, what we have learned. First one, usability of mobile care solutions can be assured. It will really design the interface correctly with right interface design principles. Okay, we can design very complex applications and used by people quite efficiently. That's my experience. I will show later. Okay, this is my first generation design. It was designed in around 2004. You can see that, but don't be misguided by the projectors. Think about at a time around 2000 or 2002, okay? At the time, the devices, the Sony, this is a Sony and it's a palm-based PDA. On your handheld, right? What's the size of the screen? The screen size is around less than 3 inches, right? It's quite small. So how we can design the interfaces and have a user to interact, actually designed for nurses to enter data, to do the assessment for pressure sore. Okay, you see these people here? This small figure here? It's a people, okay? Okay, and I can even have it turned around. Yeah, and you see that the data entry, the data was not entered by typing, it's by typing. We need to prepare the data entry first. Otherwise, it will be not easy for the users to enter data, just like Dr. Capazzo said that. For mobile devices, the data entry is really a challenge. Even let me tell you, the current challenge is even more serious in current touch-based smartphones. In the old day, we have what's that? The TIDES, right? It's easier to do precise location pointing. But with your touch-based mobile device, for iPad, iPhone, you need to use your finger. Okay? So what's the size of your finger? Have you ever think about that? So with your finger, this interface design is normal working. Okay? This is the first generation. And the design principle is quite easy. We need to organize our information beforehand. And to help users, potential users, to switch to any questions anywhere within two clicks. These are experiences. The users will not complain if only 2 taps and to navigate among your systems. But when they need to keep clicking, it will become boring and they don't want to use your application anymore. So this is our second generation. The second generation design was because after we were successful in our first generation design, the director of a geriatric center came to me, Dr. Chang. We have another 12 phones of around 300 questions. Could you please put it in your applications again? Okay, I said, let me try, because I'm an engineer, I cannot say no. Okay, so I redesigned the interface a little bit and find the device hardware with the larger screen size. Okay, but this screen size is less than 4 inches. Then we did evaluation and the result comes quite good. And so from our experiences, well design can really improve and assure the usability of applications. The second lesson we learned, the size does matter. Okay? Usually people love have a bigger size. For example, the PC, bigger is enough, it's better, right? But it doesn't good for mobile. Okay, for healthcare professionals, physicians, nurses inside hospitals, they just cannot carry PC walking around in hospitals. So when the iPad first come out, it caused lots of impact, right? So we designed at around 2010, I work with one company, ICT company in Taiwan. As you, a company in Korea. Both Korea and Taiwan, we are very good at the ICT industry. But I must admit, right now, you are better right now, okay? I don't want to admit that. Okay, so in 2011, we designed another second version. That's embedded with the barcode reader. And that's totally 100% designed for nurses used in hospitals. So it can be cleaned with alcohol, and it's one hand held, so it's easy to hold. It's 6-inch display size. So that's the first product, that's first paid on the world with the only 6-inch display size, 1-inch difference. Okay, and also there's a one hand strip. Have you ever think about why we need a hand strip with your pad? Do you pay attention to your iPad? There's no way you can handle hand strip, right? But think about that. Among your audience here, do you ever drop your devices? So how many of you never drop your mobile devices? How many of you? Raise your hands. Scholarship. Okay. So when we are holding mobile devices, sooner or later, we will drop that. But how about the situation in hospitals? When nurses, physicians are walking around and with so speedy up, right? So it's quite easy to drop your devices. So how to avoid that? So we have this kind of design, and also the devices was rugged. So whenever you drop to the floor, theoretically, it will be it will be okay. Okay. So from our first generation design to second generation to the third, you can see that the interface makes much more different. Okay. The character is much easier to read, and I believe some of you can read the Chinese characters. Okay. And even the data entry, we use the large buttons. Okay, look at this. So let's plot the difference here. And we have the first layer, so the users can easily switch to other different categories of questionnaires. This is a secondary questions. Then 2 click to the third working page. So that will be the working for data entry. You see, for example, for the marriage, married, alone, separate, or divorced. Just tap for data entry. So that's our design. And the evaluation results come out quite good. You see that, and the size doesn't matter. That's from our experiences. But we cannot have too much. And from our experience, 7-inch is really too much. Okay, and a 6-inch, 5 to 6 will be okay. But for 5, it will be categorized as a smartphone, right? 6-inch will be categorized more close to the pad. So different categorizations. So what we have under the third one, if the mobile solution can be right for healthcare professionals, what can be next? And from our experiences, for example, I share with you what we have done in Taiwan to make our nursing happy with the IT solutions. The first case is the solutions designed for home care nurses. That's the nurses working in long-term care. And they are doing comprehensive assessment for senior people. What do we mean comprehensive assessment? That means really complex. That means what? 21 pages to us in paper form. And how much time it takes? Around 2 hours for a nurse to complete one assessment. So that's impossible for our nurses to do that. Okay? But after we transfer from 21 paper format to electronic, our mobile solutions, it takes around 20 to 30 minutes. Okay? And whenever they get used to the systems, they can do it much easier. So that's what the difference. So this is our tools. From assessment to care plan to evaluation. This is the process just like what we did for nursing process. Okay? So our evaluation shows, the result shows that they are quite satisfied with the design. in different kind of questions. For example, the file size, the device size, easy to hold, and they perceive it's easy to use. We gave the devices to each subject to try under simulated cases, and also they believe they are good for their works. So this is from our experience. So this is the first case. The second case is about, let's talk about the nurse. Okay, you know that the nursing tests are quite separate, and lots of documentations. You cannot expect one nurse sitting in the nursing station one day without walking out of the nursing stations, right? The nursing station, a nurse might go to different rooms, do different jobs, just keep working. Actually, do you ever try to put a pedometer with nurses so they can count how many steps they work every day? Yeah, you should do that, okay? And whenever you reach over 10,000 steps, let me know. Okay, so when you push to the 1 million, send email to me. I will give you scholarship for that within 1 week, okay? Okay, so for nurses, their situations, we know that even in Korea, in Seoul National University hospitals, you have this kind of solution, right? You have the mobile devices on the cart. But in Taiwan, even with some of our medical centers, it doesn't work. What do I mean here? Some of our patient families will move in to stay with their families to bring their beds, okay? And sometimes so it's crowded. So this kind of a mobile card is not so much effective under some situations. But they're asking for, is there any mobile devices, especially when there's iPad coming out, they're asking, is there any mobile device they can put in their pocket? Okay? But think about that. The iPad, can anyone put iPad in your pocket? Never.
There is one doctor who revised his jacket.
Redesigned that. Yeah. And one of our medical center really think about that to give each physician, doctors, a backpack, not backpack, a pack for them to carry around. So that's quite stupid. Okay. So here, kids' case, the chemotherapy medication administrations. Because if you are a nurse, you know that the process is quite intensive because regarding safety. And during the process, medication administrations, even to assure safety, they are designed over double checks. What does mean the double checks? You will ask independent another nurse to come by your side to see what you enter, to see what kind of pump numbers you did. So that's the process. So how we can use the mobile solutions to assist the nurses to complete this job. So we re-engineer the process, okay, and design the mobile solutions for them. And the evaluations, the result come out quite good. Out of the 4, the overall score is 3.8. And in terms of usefulness, easy of use, learning, easy to learn, acceptance, satisfaction, all are quite good. And right now this system is implemented, it's working right now. And you can see that from nurses, they think if we design mobile solution for them, it simplifies their jobs. And we even embedded some decision support systems to avoid, to assure patient safety. And they also think it's easy to learn because when there's new nurses coming to their ward, they need to spend some time to teach them how to do the process. And they even think they recommend, they love the large screen. Display size really matters to them. So this is the chemotherapy. And from our evaluations, the time from original, the PC base, they took around 24 minutes for them to complete one round because they need to prepare to get the medication and get back to the nursing station, the administration of medications. The total would take them around 24 minutes. But after the new solutions, the time was reduced to around 4 minutes. So that's 80% of time. I will not say time saved. I will say loading released a little bit. Okay. How I don't want to say time saved. Whenever we say time saved, the other administrators will say, "Oh, then do we make nurses not much time to do to get them to more comfortable?" So usually we will not say save money, save time. Just say, okay, loading released. Okay. So then another hospital, another medical center with the devices. That's the ICU in medical centers. And I just show you what they do with these devices. This is quite normal, right? To identify the patients. Look at this figure here. In ICU, they directly hold the devices because the devices has been disinfected. So they don't need to worry about the infections. Okay? And then they took the picture, then what? They upload the picture to their systems and to ask their physicians whether the wound has been improved or if there is tubes, do we need to remove the tubes such that. And the physicians will respond, yes, remove that or don't. If don't do that, they will type in the answer. What's the reason the physician doesn't recommend to remove the tubes? So this become a coordinated care between nurses and the physicians. And I must tell you, this solution, this app was designed by nurses herself. It's not from engineer, it's by nurses. And she's our nursing informatics specialist. So that's quite amazing. So come to the information system, and when physicians enter give their response, they will show what doctor says. So that's a complete route. Okay. So the next question will be, if the mobile solution is good for healthcare professionals, how about to the common people? And from both shows presentations, we know that mobile health really working, right? Good for consumers, but how about for seniors? Okay, that's another challenge. So let's look at this figure here. And this number is from CDC in the United States. This is the old number, the 10 years old. But the idea is still the same. Elder populations only takes a small percentage of population, right? But they spend the most part of the healthcare place the telemedicine applied to. Most of I would say the majority of the place the medicine, telemedicine applied to is at home, right? Applied to patients' homes. What does that mean? When we're talking about the smart home, so right now we are thinking home doesn't mean the fixed location. Home is an idea, where people stay, where people goes. Okay, so if the elder people, if the patients go to have a holidays, a vacations, then his home is moving. Otherwise, your telemedicine will not helping anymore. Okay, and the third challenge is, so how to apply? Is it really working for these senior groups? And so let's talking about seniors. I believe the Korean situation is similar to what we have in Taiwan. We are stepping into edge society, right? So that, I mean, the more elder peoples. Okay, but how about, do they use smartphones? Very similar results. For this is a study done in the United States. And actually, the elder people, they still then use smartphones. Okay, they are not a group, they know much about technologies. They are not a group who use the Facebook, a Line, such like that. So they are the group don't use devices. But they are the group needs our support. So here comes the challenges. Okay, and also this group, talking about their function, their capabilities, their motion, cognition, vision, sense of touch, this kind of capability to use the devices or decaying, right? Not much as good as we do. So so this is a very special group. So here we have three questions. Are they okay with our mobile health solutions. When I'm talking about mobile solutions, I'm talking about the use smartphones to bridge senior people and the physicians after they are discharged from the hospitals. That's what I call missing health. Okay, so right now within usually within hospitals, when we're talking about electronic medical records, it's very hard for hospitals to keep data, patient health data, outside the hospitals. So that's why I call missing health. But the smartphones can do that. And the second challenge will be, are they willing to use? And the third one, are they competent of using that over time? So the first one from our experiences, yes, they are okay. So we designed some a little bit complex applications for them. These elder people, they can respond quite well. For example, go back to our long-term care solutions. We designed a solution for nurses, right? And then within the solutions, they are around 300 to 500 questions to ask. It depends on our versions. And one-third of questions can be answered by patients, the senior people, easily, without any questions. Okay? And from our studies, within 3 weeks, averagely, within 3 weeks, the senior people can answer up to 92%. And then some of them can answer 100%. That means they are okay to do to answer or to enter data for you through smartphones. And this is the design we use. You see that the button is quite large and the character is quite large. Okay. But our design, we found that we compare two devices. One is the normal size, around 4 inches display size. The other one is 6 inches display size. We found that they don't want to use the smaller devices quite. They say, well, too small, and it's not easy to read. So they have a difficulty to use the devices with small screen. So, but how about with 6 inch screen? They are quite good, okay? If we design easy to read, easy to interact, that's quite good. And we also observe that out of sight, out of mind. What does that mean? Whenever you say there's a hidden menu and there's something tricky part for the user to use. For example, right now when we're using some app, usually we don't know there's some missing part, right? We need to spend some time really to learn how to use the app, the entire functions. So when we're designing the applications, we need to display all key information on the screen, okay? Otherwise, they will not know there's a function for that. So in this study was done in 2011. But right now, you see, there's a real product, smartphone with 6 inch display size, and it's quite affordable, put on the market. So we believed, and maybe this year or next year, there should be a better solution hardware, good to be used for the elder people. So that hardware should be okay. And also from another example, another case study, we designed application to be used in elder people at their home for what? For community-based integrated screening. Okay, our traditional way, these elder people will receive a notice from our health center. Then they will go to the community center to take the screening. Okay, and we have six different kind of a screening for the elder people. So for at a site, it's quite difficult and for them to walk around, and it's quite confusing. We are thinking about, can we design some applications and send applications to them so they can answer the data assessment, answer the data before they come to the community center? So that's the basic ideas. So this is original, 6 forms for them to fill out. And this is the community center. They need to come to the community center, and there are different steps from station 1 to station 18 to complete the process. So that's quite confusing flow. Our new design is like this. Okay, we provide the application to our subjects. So they can enter, first they enter their IDs, then answer some basic informations, then answer assessment questions. After they answer all informations, the system will give him a special code. So he will bring the special code to community center, then he will go to do screening directly. So this is the system working, and the result is quite good. In our pilot studies, among around 20 subjects, they are quite old, you can see, and the school year is quite normal. It's not university seniors, so that's quite normal, and their home income, family home income is quite low. So that represents not the higher class of seniors, but a little bit middle to lower class seniors, and they can use that. They give the scores out of 100 in terms of useful, easy to use, easy to learn, trustable, acceptable, satisfied, around 85. So that's result comes quite good. So this is our second result. So that means if we provide them good solutions, they are okay with that. So next one, are they interested? My experience tell you yes. We have another design. Around 2 years ago, I opened a course. That's the course to teach senior people to use smartphones, but not through me, through my students. I teach my students to teach their parents, to teach the community colleges, elder people, to learn how to use smartphones. And you can see that we did a survey for all elder people. They have their phones, but most of them have the traditional functional phones, just to make a phone call, to receive text messages, okay? So that's quite interesting part, and that surprised me a lot. Originally, we think maybe students cannot do that, or maybe the older people, well, they cannot accept that. The process, we separate into different groups. Each group have around 5 students and 5 elder peoples. They interact with each other. At the very beginnings, the elder people, they really don't know what does the smartphone means, what does the iPad means, okay? And we even try to show them I picked some professional applications for them. I will show you later, but I failed. I think too much. And the students come out much easier solutions to have the elder people get interested. Okay, so you see, so different group interact with the elder peoples. And in one class, I just asked everybody, raise your hand with your smartphone. So that's quite interesting. So this is the situation, and they're quite happy. So they are quite motivated. And even one elder people, because attending this course, she purchased her own smartphone. That's quite interesting. Okay, this one here. But we found that not too serious at the beginning. Originally, I taught my students to teach these elder people to use these applications so they can measure the exercise, right? But the elder people cannot do that. It's too much, too complex, okay? And one of my students, they found the best software for elder people. Do you know which one? Fruit Slice or Fruit Ninja. What does that mean? I never used this game before. It's quite easy, right? Use your finger to kill fruits. Meaningless. But it works. Just like we play the Angry Bird. So what's the meaning of playing Angry Bird? Don't ask any meaning, right? Just play. Okay. So from the experiences, we observe that we start to try some very simple and fun games to teach the senior people. They start to have some fun with the devices. Then this is the hook to get them to use the mobile devices. But they need lasting support. They need support. And they need us to start from simplicities. Okay? And they also wish us to introduce some applications related to their daily lives. Not so formal. For example, when you're talking about the prevention, we might talking about the diet, exercise, and this kind of issues, but they don't like it. Okay, remember this. So the last question will be, are they competent? Can they really do it? Right now, because so many senior people, they really don't know how to discover new technologies. Can we teach them? Or can they be well taught so they can easy to live with these devices? Okay, so we have one project is supported by our government around 2 years ago. And then maybe next year I will come here to present our results to you. We call it the successful aging by away from your home. We encourage our elder people just to go out. Okay, this is the TV commercial quite famous in Taiwan. Actually, they are real people. And even there's a movie shooting for them. Because when they are getting old, this is when they were young. Okay? They were young here, and they were promised to go out maybe someday in the future. But when they're getting older, some of them passed away. And they decided they will not give up. They will start to enjoy their life. So this is the story. So inspired by this one, we encourage them to go out. And we call it a wander around. Can we have them wander around? But we can provide health watch 24 hours per day and 7 days per week. And also the information can be supported by doctors and the nurses. And so they can enjoy their happy lives at the end. So this is our systems. And from our system, we have the devices, mobile solutions used by elder peoples. We have call centers. And these centers, how many of you nurses? Can you raise your hand? Do we have nurses here? How many of you? Maybe I change another question. How many of you are non-nurses? Okay, all of you are nurses, okay. I'm kidding. Okay, and because this is the part of 10 years, I spent a lot of time with nurses. And I taught nurses in Taiwan and also students, young nurses in China. This is your future, okay? Nurses can play a very big role in mobile health, okay? When we provide mobile devices to connect patients and physicians, do you think physicians can take everything by themselves? No. Okay, and do you think physician is a good manager? Well, okay, so these are good challenges. So there's a really good need for good nurses to stand out, to understand the design, the situations, so you can play a very important role in management mobile health. So this is your future, just like long-term care. Okay, in Taiwan, only physician can be the president of a hospitals, right? But nurses can be the president of long-term care institutes. Similarly, in the future, nurses can be the leader of a mobile health solutions. Okay. So through our call centers was stepped with the nurses around. We will not say 24 hours because these are pilot studies. Around from 8 to 10 at night. So I would say around 16 hours. Okay. And then if there are situations, our system will collect the data from mobile devices routinely through vital signs and also self-assessment. The nurses at call center will do some normal contact. If there's emergencies or less abnormal, they will pass the information to physicians, to hospitals, and the hospitals will contact the patients directly. So this structure is quite similar in all kinds of mobile health solutions. Okay, so we developed a competency scale, how to measure the senior people have the capabilities of using our solutions. So in our study, we design and validate that there are 7 kinds of capabilities. The first one is about basic skills and knowledges. At least they need to know where's the on and off button, right? And how to make a phone call, how to send or receive short messages, how to build a correspondence list, how to tell picture taking. That's quite normal, quite basic. Then they need to understand what's the desktop management. And then they need to know how to download applications and run application by themselves. This is a little bit advanced. And I must tell you, we spend lots of time here. Desktop management. So when you go home, try to talk to your grandmothers. So what's the desktop of the smartphones, okay? And tell them, this is what app, what's stored behind. Well, that's a long story. Okay, so we developed this kind of scales, 7 categories with 34 questions. So, and we based on these scales, we design our training courses, okay? And all training courses, we have a training map and a menu. The training map, this is actually our app. I just show some screen size here. And the button is quite large. And the character is quite large, easy to read. We use the smartphone with the 4-inch display size. This is quite a common one. Our training map, the learning map, was printed on A3 size. So what does that mean? Usually we will only provide them with the paper form with A4 size, right? But we want to assure they can read the design carefully and show them the real application size on our map. So we use the A3 size with color format. So it costs a lot of money. So we do test and follow up through cell phones. We provide them each one with the smartphones, and it's supported by our. Just like you have a Korean communication company, right? We have a Taiwanese communication company, so we just founded. So our preliminary results show that most of them are female, and they are old, and all competency items were significantly improved after training. That means if we can provide the right training materials and they're using right scales, we can monitor, they can have a basic competency to use our smartphone applications. So from our experiences, it's promising. So the senior people can be, I would not say can be trained, can learn how to use these mobile devices. Okay, so this is my last slide. And the next year we are going to hold the coming Global Nursing Informatics Conference in Taipei in June. So please come to us. 2006, it was here. And the next year, come to Taiwan. So if you are students, you have any difficulties, I can send an email to your parents. Okay, that's for research, for academic, required by Dr. Kim, okay, to come to Taiwan. Okay, thank you so much.